All right, well, I've got 6 o'clock, so thank you everybody for coming to our Zoom webinar on the Birds and the Bees 2. This is the Ask Us Anything. And before we start, just wanted to let everybody know, first of all, thank you for coming. Second of all, this meeting is being recorded, so this replay will be available for our attendees. Right now, participants are in listen-only mode. So if you have any questions, please use the chat feature, and it works best if you direct your question to chat questions. So I've changed my Zoom name, has chat questions in the front. That way, when we get to the Q&A, we'll be able to moderate all of those questions for you. And today, doing our presentations, we have Healthfirst, Patch, and Public Health here. Ashley, did you want to introduce yourself from Healthfirst? Just say hi and your title.
Yes. Hi, everyone. My name is Ashley Hahn. I'm the Public Relations and Education Specialist with Healthfirst Network, and I'm also a Certified Health Education Specialist. So glad to be here today.
Thank you, Ashley. We're glad to have you. And we also have a really good group from Patch. So if you guys want to take a minute and introduce yourself.
Yeah, so I'll go ahead and start our patch intros here. Hello, everybody. My name is James Woods, and my pronouns are he, him, his. And I am the Patch Madison site coordinator. So I'm the person who is like bringing teens in and bringing them to events and all of that jazz. If you have any more questions about Patch, feel free to like DM me and ask for my contact info. But from here on out, I'm going to go ahead and let our teens introduce themselves as well. So whoever wants to go first, go ahead and jump on it.
My name is Isabel. I use she, her, hers pronouns, and I'm 17.
My name is
Alex.
Oh, you go. Okay. My name is Shanice. My pronouns are she, they, and I'm 17.
My name is Alex. I'm 15, and I use she, her, hers pronouns.
All right, thank you so much, everybody. Really appreciate that we have this awesome group from Patch here to help us with our presentation today. And then we have a couple of staff from Public Health Sauk County, and we're more here as a supportive role. And if we have questions that come up, we'll hop on in. So moving on from there, we're going to hand it over to Ashley so that she can do her presentation on having the talk with kids. So Ashley, take it away.
All right. Are we ready? We're going on a journey together. It might get a little weird for some people, might be a little awkward to hear, but this is, I assure you, all really good things that you'll be able to take with you into your homes, into your families, to hopefully keep everyone safe and healthy when it comes to sexual and reproductive health. So we are going to get started with having the talk with kids. So what we are going to cover in our time together here, we're going to start with, should you have, aka the talk, when should you start having that talk, what should you talk about, and how to say it. So starting off, kind of defining the talk, it can mean a lot of different things for a lot of different people. And just wanted to start off with, like, it is not just about sex. It is not just about sexual intercourse. It is all of this stuff on the slides and more. It is talking about social media, human trafficking, peer pressure, dating, online safety, communication, decision-making, healthcare, emotions, consequences. It is so much more than just sitting down and talking about how to have sex, why you shouldn't or why you should, how it happens, but it is talking about all of this stuff together. And it is also not just about talking. The biggest point, and I'm going to be on repeat with this, but it is about building an honest, safe, and caring relationships with the youth, adolescents, teens that you might be talking about reproductive and sexual health with. And just, it's really important just to let the teens and the kids know that you are there to help them with whatever they need. So it's not just about what we're talking about, but how we talk and how we have those conversations with them. So what we are going to do here is I just have some statistics on showing, kind of painting the picture of where parents and guardians are at about talking to their kids about sex and everything that comes with it. So I pulled some data. It's a little outdated. It is from 2011, where over 1,000 parents who are parents of children between the ages of 10 and 18-year-olds, they were selected to kind of represent and take this survey. And they stated that about 97% of the typical US households are being seen and represented in this survey. So the first kind of statistic point was that of these 1,000 parents, they said that 43% of them said they feel very comfortable talking with their children about sex and sexual health. So that leaves about 57% of them say that they only feel somewhat comfortable or they feel uncomfortable talking to their children about sex and sexual health. So that shows us a little more than half of parents and adults of 10 to 18-year-olds are a little comfortable, or they're most likely uncomfortable about having these conversations. Kind of changing gears is that 93% of those parents said they feel confident about their ability to influence whether or not their child has sex. And this is absolutely something we're going to talk about, that they should feel confident, because the parents and guardians are the #1 educators that these teens and kids are going to listen to. They want to hear what you have to say about this, so that 93% of parents feeling confident is exactly how they should feel. And then lastly, 64% of those parents said that their own mother or fathers did a poor job educating them about sex and sexual health. And that's where a lot of the uncomfortable feeling, the awkward, embarrassed feelings from this are coming, because a lot of parents and guardians now of young children and teens did not have this conversation when they were young. So this is a very new area for exploring for them, and really important to talk about. So kind of hitting our first bullet point of should you have the talk? According to kids and teens, the answer is a big yes. Yes, you should have the talk with them. Kids and teens want you to have that talk with them because they feel the most comfortable with you. So you can see there that it says parents have the greatest influence over their decisions about sex, and teens feel more comfortable about the topic when parents talk with them. It might not be comfortable, but they're gonna feel more comfortable about you having that conversation with them than someone else. And then looking at the research of should you have the talk with them, again, it is a big yes. Teens who talk with parents, the statistics are just amazing. They are more likely to, one, delay the age of when they are having sex. They are going to start using condoms more. They are going to have fewer sexual partners, so engaging in less sexual activities with less people. And this is going to decrease the STI or STD rates, and it's going to increase the ability to discuss with their partners. So should you have the talk? Yes, the teens, the kids, they want it, and research is backing it up so much that it is going to keep them safe and healthy. And then also a little note down there, talking about sex with kids encourages them to wait and be safe. So that is a big myth that is out there in the world, that if I talk to my kid about having sex or using condoms, they're going to go do it right away. And the research is there that they aren't, and it's actually going to delay them from starting to be sexually active. So moving on to, should you have the conversation? Absolutely. So now when should you start? And again, another a trick question is you already have started, whether you know it or not. We know that the kids, the teens are little sponges that soak up everything, and they are already watching you on how you dress, how you carry yourself, how you interact with the opposite sex. If there's intimacy or affection on TV or around you, how you are reacting is teaching them how to react and how they think they should be reacting. So whether you know it or not, you have already started. So I kind of have 4 bullet points on when you should start. The first one is, it is never too early or late to start. So a lot of people think there is like this perfect age that they need to be hearing this, but this is actually a process throughout their lifetime. And then some people think, shoot, I missed my opportunity. I missed that window. They're now in middle school, they're in high school, they're in college. It's too late to have the conversation, but it is never too late. They are always going to need more information, and you are that safe source that they can get it from. Next is when you should have these talks. I said it should be a process throughout their lifetime. And that's because there are so many different age appropriate topics. So what that means is the topics might be staying the same, but the details or the information or the vocabulary that you're using can really change throughout to start advancing it, which means we can keep it really, really simple using those age appropriate topics. Slowly build over time, my little turtle guy here. So this is a slow process. That is kind of another myth, that you need to sit down, you need to have one big talk with your kids, and they're going to be set for the rest of their life. That is something that is also not accurate, that this needs to be open communication, conversations, discussions over time. So it should not just be one big talk, but it should be a bunch of small little talks, or just one question every now and then to just get information, see where they're at, see if they have any questions, and check in. But we don't want to have just one big talk and that be it. And then lastly, I have look for opportunities. So this is, there are opportunities knocking at your door every single day. Some good opportunities that might be a good place, a safe space to start asking questions, having this conversation, can be in car rides, especially if there are other siblings around and you want to keep it to the age appropriate topic for a 13-year-old, an 8-year-old. If you are picking up, dropping off, or school events, whatever it is, that those car rides can be very, very crucial to having these conversations, as you're stuck in the car together. It might just be the two of you, and it's a good time to have conversations. It also can be bedtime routines, waking up routines, getting dressed. I'll talk a little more about that, but that's another opportunity that is right there each and every day. If you are watching TV, movies, reading books as a family, those are all opportunities as well that can open the door to different conversations, going for a walk, and even just simply asking, what did you learn in school today? Can be really simple opportunities to have the talk with your kids. So okay, Ashley, it's bedtime. I'm in the car with my kid. What am I supposed to do? What am I supposed to talk about and when? So we're going to kind of walk through the different age groups and different topics that you could be talking about. So starting off with our preschool, so that's 0 to 4 years. So remember, these are just kind of age appropriate topics. We might not be sharing as much details as with the preschoolers as we are with the high schoolers, but we can kind of tone it down to what you're comfortable with, what topics you want to talk about. So the very first one, with the 0 to 4 year olds, they are learning new words. They are exploring their bodies for the first time. And the most important thing that we can do is start using the scientific names for body parts. So whether it's the vagina, the penis, the vulva, talking about their ovaries, things like that, they might pick up on that stuff, but not using those slang words of your pee-pee, your hoo-ha. My grandma liked to call it your Tinkerbell. I don't know why, but we don't want to be using those slang words, but we really want to use those scientific words. When we are using slang words and we are not saying penis, that this is your penis, this is your vulva, we're not normalizing those body parts. Like we tell them, this is your elbow and this is your thumb. But when we start using nicknames for body parts, it's sending that message of, oh, I can't talk about this, or I should be scared to talk about this part of my body. And that can lead to many, many different fears and anxieties about the private parts of the body as they're getting older. A good topic as well to talk about this age group are boundaries and consent. But it is going to be very, very simple of, we all have our personal bubble. This is my bubble, this is your bubble. If anyone ever crosses your bubble and you don't like it, you don't need to put up with that. Or if we don't want to be touching, taking toys, we need to respect space. So just kind of teaching, this is my space, this is your space. We can ask to have hugs, we can ask to share toys, but we want to just kind of start building the boundaries and consent at a very young age. Another example is if they're playing. So I said using toys, or if we're playing tag. And if someone doesn't want to be chased, that we need to stop chasing them. Like they are now uncomfortable, or we are getting too close to their bubble, their personal space, we need to stop when they say stop. And that is consent in the simple words. If someone says no, you stop. Next is talking about privacy. So this again can be expanded throughout the years, but at this 0 to 4 years age of just talking about your private parts are private, and that doctors and parents can see them, and that is okay. They are going to help you, but no one at school should be seeing your private parts. No one, if anyone is asking, you should not be showing them, because they might not be able to tell, like, oh, I showed mom at home, so I can show the teacher in the bathroom and preschool or whatever it is, but teaching them like who is allowed to see that part of their body and who is not. Next is practicing communication. So they're obviously learning new vocabulary as well. And just really, really pushing just using words and communicating. So if someone is upset, to use words to express that. And that can be really difficult at this age, as they don't have a lot of vocabulary or might not know the right words to things, but teaching them about different emotions and how to handle that. And also just making sure that they're comforted when they are upset, because that is then teaching them empathy and caring. So if they see someone like that, they know how to react. So what can you be doing if you have a 0 to 4 year old, or you're going to, what can you start doing now or in preparation for the future? Learning the anatomy. So like I said, a lot of us didn't get this education from our parents before, and this might be something really new to you. So kind of get prepared and learn about the anatomy. Learn about where the penis is, where the vulva, where the vagina, the urethra, things like that. Start learning that so you know it. One, so you can talk to them about it. But if they ask a question, like, what is this? You already know the answer, and can teach them the correct scientific name. You can also start thinking about your values when it comes to sexual activity and reproductive health, and just kind of preparing. At what age do you see them doing what, allowing what are your personal values about when they should have sex, or vocabulary you want them using, just kind of getting that in the back of your head. And then the last thing is watching your reactions and tones. So like as they pick up on everything. So if someone says the word penis or vagina and you start laughing or, oh man, we don't say that, they're going to pick up on that and they're going to start associating with those words with these either negative emotions, or they're going to start laughing and think it's a joke. Those are just some things to watch. So like I said, there are opportunities everywhere. So here are some opportunities for talking to those 0 to 4-year-olds. Bath time. That is a time when they are splashing in the water, looking at their body, learning body parts. So that can be a really great time to start introducing the names of different body parts. Getting dressed in the morning or getting ready, putting our PJs on, choosing different books or what they are watching on TV or whatever it is. And also pregnancy. That is another opportunity that I didn't mention before, is that if there's someone in your life that is pregnant or is soon to be, whatever that is, that can just be a really, because we know the kids ask, what's in mommy's belly, or what's in the belly, what is this? So that can be a really good starting spot to just simply talk through that process and the details that you feel comfortable with. So moving on to our next age group, so our 5 to 8-year-olds, so our kind of elementary years. So this is where we can start introducing the idea of sex, but again, making sure that sex is something adults do. Like someday when you are older, this is something we can talk about. This is something that you might learn, but kind of keeping that, you can start the conversation, because at that younger age, they're not really going to grasp that very well, but it can start being a topic of, this is what adults do. This is an area where they are in school now. They are meeting friends and having friend groups and new family members. And so this is a good time to start asking those questions and start learning what they already know or what they think. So if they ask a question, a good follow-up would be like, great question. What made you think of that? When they ask, like, what is my penis? So they heard that from somewhere if it wasn't from you. So that is a really good question. We want to like reassure that they can ask those questions to you and learn, where did that come from? Because they are obviously grasping that information from somewhere else. This is a time to start talking on the basics of puberty, preparing them for the changes that are going to happen. This might be crushes, starting to feel attractions to someone else, and just letting them know that you can't act on that attraction, whatever they're feeling. It's going to be hard for them to define, but they need to make sure it's mutual, that they want to go give someone a hug, they need to ask and get consent and give a hug like that, or chasing on the playground, the example that I used. Healthy friendships. So they're in school and they're making friends for the first time. So again, this is just going to be touching on, one, the privacy, the boundaries and consent that hopefully they were getting at the very young age, and just teaching them about how we talk to our friends, how we treat our friends. So again, talking about sharing, checking in on our friends, having good conversations, things like that. So what can you do? Again, at any point in time, it's good to learn about the anatomy, thinking about your values, watching your reactions and tones, but now it's time to start modeling behaviors, and time for you to start learning about puberty or what to expect. Since the age, puberty can hit at a younger age, some are more delayed, so just being prepared for that to come and what changes physically that they are going to go through, but also emotionally, so you can prepare for those strong emotions through puberty. So when is a good time? Again, it could be bath time, taking a shower, helping them get dressed in the morning or at night. Again, pregnancy, if either you are expanding your family or you know someone else, again, it's a good time to walk through maybe how they got pregnant or how the baby got in there, talk about different body parts. And then again, in the cars, watching TVs or movies, if they see a tampon ad on TV or they see someone kissing on a TV show, that can open the door for all of these conversations to happen. Moving up to our middle schoolers, our 9 to 13-year-olds. So this is a strange time in their lives and also yours as you are a parent guardian to a teen. This is where their socialization lives are shifting from my parents are the best to I don't care about my family, I care about my friends. So their peers, their friends at school are going to start taking number one in their life, and that is where they are going to want to go to have these conversations. This is where they might start hearing things from other students that might not be true. They might be talking about different conversations around sexual and reproductive health. And so we want to make sure that we're checking in with them at this time because they're going to be getting a lot of new information from their friends as their peers are number one now. So something to talk about with them again are puberty changes. So this is when it's going to happen. So talking about girls that they're going to be developing breasts, body hair is going to start growing for everyone. Menstruating, periods are going to start. So starting to have those conversations so they don't get scared or nervous when it starts happening. And then for the boys, with erections are going to start, ejaculation, those wet dreams are going to start happening too. Body hair, voices are going to change, growth spurts, all of that is good information to start talking with them to get them prepared for the changes and help them walk them through that. Again, personal values and beliefs about sex. So this is your time to lay the foot down and really start sharing with them before they are sexually active or at that age, and teach them when is it okay to date, when is it okay to kiss someone, when is it okay to touch someone, have sex. This is where you are their parent, their guardian, and you can set those rules and boundaries in your own home. Masturbation. This can start in this age as well with puberty and things like that. This again can fall right in the values of however you view masturbation. Absolutely talk to your kids about what your values are on that. But some things that typically come with the conversation of masturbation is it's wrong, it's dirty, and that is causing a lot of guilt and shame and fear that can create a lot of these difficult emotions for these hormonal persons to be going through. So just letting them know that it is normal, people do it, it is harmless as long as it's in private. Like there is a right and a wrong time to masturbate, to be thinking about that, things like that. So setting those boundaries. And this is also the age where it's important for parents and guardians to start knocking on those doors. They're going to start wanting privacy. Like I said, family, that second, third, their peers, they're learning about themselves and they're going to want some more privacy. So making sure that we're knocking on those doors before we're entering. Another kind of difficult topic to talk about is pornography. Again, this is something that can be really, really difficult to control. or you can set really good boundaries with your kids, but their friends could be accessing pornography and showing them at school. If they're having sleepovers, whatever that may be, it's really easy to access, sadly. So one, setting parental controls, whether they have a phone, tablet, TV, internet, whatever that is, making sure that your values and beliefs about pornography, and when or if that is ever okay, that you are putting control on that access. It is also important to talk about how they came across it, how they came across pornography. Did a friend show them? Is it an app on Instagram? If that popped up, and making sure we're monitoring different apps, things like that. And the biggest message around pornography is letting them know that that is not how real, safe, and healthy sexual activity looks. That most of them are acting. They are actors that are trying to put on a show and get paid, and they are paying for their home or their food, and that is their job. That it's not an accurate depiction. They mostly leave out consent, so there is no conversations about if everyone even is comfortable with those sexual activities. They are never showing that it's okay to stop at any point in time and having those conversations. They also most likely are never using protection. There are never condoms or things like that being put on. Conversations about getting STI testing, if they're on birth control, if they need it, things like that. So just touching on pornography is really just a show, and it is not showing real healthy relationships and sexual activity. Moving on to our protection. So we want to start telling them about their protection opportunities to start keeping them safe and healthy if they become sexually active. So both birth control and STI protection. So whether this is in your values and beliefs or not, it might be a good time to teach them about different types of birth control options, or that is a conversation that can wait for down the road. And then also STI testing, STD testing of where they can go, what STDs are, how you can get them. That this is a conversation that you can start, or it can be something that is pushed off at an older, mature age. This is where I wanted to take a pause and talk about HPV vaccine. So HPV vaccine, we had a question from before, and that HPV vaccine is a great way to protect ourselves from STIs, STDs. So a little bit about HPV vaccines. This, and it falls right into this age group as well, is that the recommended age group to get their first dose of their HPV, the human papillomavirus vaccine, is age 11 or 12. They can get it all the way up to the age 9. That is when it is medically cleared by the FDA, saying they can get the vaccine at 9, but they kind of prefer the age 11 to 12. So that's where they can get their first dose. And then it is a 2-dose series. So then they would have to come back either 6 months or 12 months after their first dose, and would just have to get their second dose of that vaccine. If it's not started at that younger age, they can start it at any age, but if they start it on or after their 15th birthday, that is when they are going to need 3 doses. So 15 or below, they would only need the 2 doses, but 15 and older, they're going to need 3 doses over the span of 6 months. You can get the HPV vaccine up to the age of 45, but after the age 26 is when there needs to be a discussion with your healthcare provider before they just give it to you. But if you're younger than the age of 26, anyone can go get that. It is FDA approved up to 45 years, but by then they most likely have already been exposed to the human papillomavirus, and so it might not be effective, but there are some people that might still want to get it. What this vaccine does is it prevents the human papillomavirus, which is known to cause several different cancer-causing infections or precancerous cells. So it's very important that this vaccine's out there to help protect against different types of cancer. And the only side effects that are common with this vaccine, like any vaccine or medication, are pain in the injection site, nausea, headache, dizziness, fever, and then there's very, very rare occasions where a severe reaction might occur where there might be increased heart rate or shortness of breath. That's my plug for the HPV vaccine. So back to talking to our middle schoolers, to our 9 to 13-year-olds. Again, when is a good time? TV and movies, advertisements, like I said, if it's we know those condom commercials are out there and they can catch your attention really fast, and then you're like, oh shoot, that was for condoms. You never know what's coming. But advertisements for different menstrual products, social media, if they start talking about first crushes or kisses, this is a really good place as well to start talking and having these conversations. All right, we got our high schoolers now, our 14 to 19-year-olds. So again, this is a good time to talk about puberty. They might still be going through it. Well, they will be still going through it. Some might not have started yet. Some of those later bloomers, which is totally normal and okay and healthy, but still talking about puberty and the body changes with that. Again, you are their parent, their guardian, and you can push your beliefs and values, whether it's about dating, relationships, like I said, kissing, touching, having sex, and just a question to think about is, when do you believe it's okay to have sex, relationships, etc.? Figure that answer out and tell your kids, your teens, about those expectations you have for them. Talking about protection. So again, birth control and STIs. You might start thinking that, okay, it might be time to take them to the doctor and have the doctor walk them through different birth control options, talk about different STIs, things like that. Pregnancy. That is a topic to talk about because we know that the average age for teens to be sexually active is 18. So that is right in this high school age group. And so pregnancy can happen at any time. So it's a good time to talk about how their life is going to change if they are not using condoms, using birth control, whatever that is, and how a pregnancy could change their life. And just kind of talk them through what are their future goals and dreams, and showing them how a child, how an STI, a severe infection, can change that, and just kind of really paint that picture clear for them that there is a huge risk with being sexually active, but there are these resources that can help prevent that and keep you safe. Another thing is healthcare, so doctor's appointments. This might, like I said, might be a time where you schedule an appointment for them, or you teach them how to schedule those appointments. Of, if you are sexually active and you want to talk to a doctor, here's how we can schedule this. Here's who we can go talk to about these topics that you might be interested in talking to a doctor with. And then very, very importantly, I get this from Patch, right out of the Patch training that I have the high schoolers go through, is giving them time alone in those doctors' offices. They might want to talk to their doctor and they might be there, but if you're sitting there holding their hand right next to them, that's going to shut that conversation down. They might be completely comfortable having you there, and that is totally okay, but most likely they might want some one-on-one time with the doctor, and I'm sure our Patch teens will talk more about that, but giving them some space. And then again, when TVs, movies, you're going to the movie theater, sitting on the couch together, advertisements, social media, school events, so prom and dances and football games, staying out late, driving, that opens the door to a much bigger world and some risky behaviors. So setting good boundaries and letting them know their resources that they have. So those, we're kind of walking through the different age groups. So kind of going overall again of just having this conversation about sex and relationships and healthcare and stigma that's out there, all these things. These are just some overall tips. So number one is kids have a lot of questions and they need those answers, but remember that they don't always need the details. So using the example for talking about pregnancy is, where do babies come from? So if we're at that 0 to 4 age, is the baby grows inside the belly and it is delivered through the vagina. That's it. When and then we're going to start taking steps to increase that sex happens where there is sperm and an egg, and you can get into those details, but they don't always need all of the details at the younger ages, but they need answers, and those questions shouldn't just be pushed aside at all. Sharing resources. So if you come across a good social media post or a pamphlet at the doctor's office, share it with them. Let them kind of take a look at it, read it, let them try to interpret it and understand it themselves, and then say, hey, I'm here if you have any questions, but I just thought this might be good for you to read. Another tip is better for preteens to know about this stuff before they need it. So making sure that they are prepared and responsible to make those decisions. So if we have a 16-year-old who has their driver's license, they're going to the football game, and they are being touched and kissed and they like it. This is maybe their boyfriend, girlfriend, partner, and they are consenting to it, and shoot, they asked about having sex and they don't know anything about the risks. They don't know anything about what they should be doing, using condoms, birth controls, getting consent, setting boundaries. So making sure that you have those conversations before they're in those situations where things could take a hard turn. And then lastly, considering individual differences. So this might not work for your kids and your teens, and that is totally okay. It's not a mold that we're trying to fill. These conversations, these topics are going to happen at different ages and times for everyone. But trying to get to know how your teen and your child learns, or how are they impulsive? Do they like to make decisions right away? Because that is going to be important to know, that we got to get them educated before they might even be in a situation, because they might make an impulse decision really quick. Or if they're a literal thinker, if they have delayed social skills, hormones might be happening earlier. Just kind of getting a gauge on where your teen and your kid is at, and when to start having these conversations and what they might look like. Okay, so we got to know what to say, and now how the heck do we say it? So it's staying informed. Again, like I said, figuring out what they already know. They might have already learned some of this in school, and you just give it the thumbs up and say, great, like, let me know if you have any questions. Learning about where they are learning and receiving information from. So there might be certain friends, there might be certain websites that are coming across their phones and their tablets that you want to kind of monitor a little closely, and then learning about what they're learning about in school. So staying up to date with health classes in elementary, middle school, high school, and asking those questions to the teachers, to the curriculum directors of like, hey, I'm just curious, what are you going to go through? Absolutely okay to ask those questions. Being honest. So share your beliefs and expectations. If you expect them to wait and have sex until you're married, share that with them, but also let them know that there are resources if they ever need it, if they want to have conversations. And then admit when you don't know the answer. So look it up together. Stay relaxed, don't jump to conclusions, and avoid overreacting. And then also watching your tone and facial expression if they ask you a question. while you're having these conversations. And then keeping it positive. This is a big one. Invite discussion and questions, letting them know that you're always there for them. But don't try to scare them away, because that does not work. There is so much research out there that trying to scare teens away from don't have sex because you're going to ruin your life and you're going to get pregnant. But talking about the benefits of why you want to protect yourself. You can reach your hopes and dreams. You can protect yourself from cancer, all of these things. So my last little thing is remembering that it's okay to feel awkward, embarrassed. All the emotions are going to be out there. You're going to be sad. Your little kid, your little girl, boy is going to be growing up. And just remember that you are teaching them how to protect themselves and stay as healthy as they can. Those are just some resources for you all. And that is it.
Thank you so much, Ashley. That was really helpful and a lot of information for everybody. So we're going to switch on over to our Q&A. If you have any questions, again, you can use the chat questions feature. Otherwise, give me a moment here to switch back over to our list of questions that we had received ahead of time. So one of the questions that we had that was not yet covered in Ashley's presentation was that learning about abstinence is really important. What is the best way to teach teens about abstinence? So I'll throw that out to our panel and hop on in with answers.
I feel like the best way to teach about abstinence is to make it feel like it's a non-judgmental environment. Like, obviously, if you're going to talk about this with your teen, from the get-go, the words you use might make them nervous or uncomfortable. Like, hey, I need to talk to you about something. My mom said that. I think I was in trouble. So I think if you want to talk to your teenager about that, or child, whatever, you need to approach it in a way that's non-threatening and welcoming. And also, I think you really have to understand that even if you share that feeling with your kid, that doesn't necessarily mean they're going to listen to you. So while they should listen to your advice, you yourself should also be prepared for them maybe not to follow it, because we're all different and we all have our own plans and our own agendas. And as long as you get your point out and you educate us, that's really the best thing you can do.
Thank you, Isabel. Any panelists have anything else to add to that before we move on to the next question?
I was just going to say that when talking about sex and stuff, I think having abstinence and talking about that should not be in the same discussion as the topic of sex. I think you should just explain what it is for what it is, and then you can talk about what your personal beliefs are and what you go about abstinence, rather than just preaching that abstinence is the best way and like making the child feel like they're not knowledgeable enough about like the topic of sex. So I think not like hiding it and just talking about it and then being like, oh, well, for me, I believe that you should stay abstinent until this way, till this age. And kind of just going off of what Izzy said, I really believe that you shouldn't like pressure the child. And at the end of the day, they may not make that same decision. And you have to respect their own ideas and like preferences on their life. So, yeah.
Thank you. Anything else? We really appreciate that input. Thank you very much. Another question that we got was, what are the health risks associated with being sexually active, and how can I talk to my child about them?
I think that it's really important to educate teenagers on what different kinds of STDs and STIs you can get from different sexual activities. And so if you kiss someone, this can happen, or just really being knowledgeable about, you're not going to get an STD from someone because you hold hands with them. That's not the way that it works. So making sure that they know the facts about, this is how it happens, this is how you can treat it, letting them know what certain rashes, bumps, things like that might look like, might mean, and just making sure that they know that they need to get that checked out, they need to talk to you about it, they need to be safe if and when that does occur.
Thank you, Alex. We have a couple more medical type questions. So one of those is, how do I test for HIV using a home toolkit?
I can hop on that one. So at home toolkits for testing for HIV, those can be bought at pharmacies, drugstores, online. There are websites, the local health department. I don't know if Sauk County offers them, but some different organizations and health departments might offer those at a lower reduced cost. But they are a swab, so they are looking for oral fluid from the gums. And you kind of just put it into this device that comes with the test that you buy, and you should get your results in about 20 minutes. So they're pretty simple. You just have to kind of find where you can access that and swab the gums, getting that oral fluid, and you can test for that at home.
Thank you, Ashley. We also, at this time, Sauk County is not able to offer the HIV test kits. So to answer that question as well. More on our medical related questionings, we have a question asking, can you tell me more about abortion?
Yeah, what do you want to know? I can kind of paint a simple picture of it, but this is a very complex topic, especially now more than ever. But currently in Wisconsin, abortion care is illegal unless it is a emergency and is a medical necessity, an emergency case scenario. Wisconsin does border two safe haven states, so Illinois and Minnesota. There's different organizations that are helping people travel and access clinics in those states as well. But kind of simple about what abortions are, there are really kind of two types. One is like a medical procedure where you go in and have a medical team kind of help clear out the cervix, the uterus. But then there's also a medication abortion that consists of two different pills that help kind of clean out the uterus and kind of help things move through and then end that pregnancy. So those are just a simple picture of abortion care in Wisconsin and how it kind of works.
Thank you. Kind of back now to the teens. We have a question of, at what age did your parents have the talk with you? And was it one big conversation or many smaller discussions?
I had the discussion in many like different small increments. I remember like kind of like that same how the presentation was set up. That was kind of how I had my talks. Like from preschool, I had conversations about nobody's supposed to touch me if I don't want to be touched. Just like those basic things like that. And then as I gotten older and I heard things from school, I asked my parents about it. I think I was like maybe first grade, second grade, so a bit earlier, but my parents kind of explained it to me in a way that was appropriate. And yeah, I think, yeah, kind of like that.
My parents, so both my parents are divorced. One lives in Washington, one lives here. Both are very, I'm sorry if you hear background noise, the janitors are moving around. I live in a very sex positive household, so I kind of had these discussions pretty early on. When I lived with my grandparents, they didn't talk about it much, but when I moved in with my mom when I was about 12, like she didn't have any issue like talking to me about it. And especially my parents in Washington, like it's not even like weird. I'm not even like, why are you talking about that when we bring it up? It's just casual and it doesn't feel like I have to be ashamed or anything. But yeah, I'd say about 12. That's when I started having these talks.
Thank you for sharing. Anybody else want to add to that?
Could I also say parent? Yeah, sorry, could I add something?
Yeah, of course. It looked like you were just frozen for a second, Alex. Just want to give you a heads up.
All right. Okay, sorry, my phone is super glitchy, but on kind of the opposite end of the spectrum to Izzy and Shanice, my parents never really had any kind of conversation like that with me until it was already too late. So by not having that conversation really ever, there was a lot of damage that was done and a lot of misinformation learned from social media, peers, even school. And so I think it really is important to have those conversations with your kids because it can do a lot of damage if they just don't know anything.
Thank you so much for sharing, Alex. That's really helpful information for people to know. All right, another question for our teens. We got some tough ones here. The next question is, how do I talk with my parents about my sexuality?
I'm gonna answer this one because first, not for everybody, because I have to go soon. But for sexuality, again, me personally, my family is very like pro inclusivity, pro like LGBTQ plus. I've never felt like I couldn't um tell them that I'm attracted to both boys and girls. And even my grandparents, even though they're old and kind of crotchety, I never felt like I couldn't say anything to them. So wait, was the question teens asking how they could talk to their parents about it?
Correct. Thank you.
Okay. Honestly, it depends on the it depends on the parent. Because if you live with your parents, you know how they are, you know how they act. And if perhaps they act negatively towards that, maybe you don't bring it up unless you really, really feel comfortable doing so. But I'd recommend not if, they tend to get violent or prone to there's the possibility that they could disown you, like the worst possible outcome. If you think that's what's going to happen, I would say keep quiet and wait till you move out. But if they're just a little on the fence about it, I think honestly it might be beneficial to tell them because perhaps that might change their mind, considering that you're their kid and they know you and they know that you're a good person and whatnot. So it really depends on how your parents are and what they believe in.
Thank you for sharing. Do any other panelists have anything to add to that question?
So I come from like the opposite perspective of that because my parents weren't in the beginning very accepting when I did come out. I think it's really important to have a discussion about what their thoughts and beliefs are on the LGBTQ community and where they stand, and kind of slowly if you really feel the need, because at the end of the day, coming out is just something that if you feel comfortable doing, you should do it. If you feel like you can live in your truth without like needing that grand gesture of coming out, you should do that too. But if you're in that situation where you just want to tell them, I definitely think just having a sit down conversation, being like, well, I see that these are your beliefs, however, these are my beliefs, and I am like X, Y, and Z. So yeah.
Thank you. Any other panelists have any input on that question before we move on to our final question? Okay, so for our final question, we have another follow-up question for the HIV testing. And the question is, if the home test is positive, is a confirmation test needed? And what should a person do? So we'll pass this on to Haley, one of our public health nurses.
Yeah, I can help with that one. So if a rest, you could definitely go to me.
Your audio is a little glitchy, Haley, maybe without video.
I turned off my video. Can you hear me now?
It's better now, thank you.
Now, okay. So yes, if a rapid home test is positive, you would need to get a confirmatory test. And you could go to your primary care provider, or you could go to Healthfirst, where Ashley is representing tonight.
Thank you. So that is all that we had for questions. To wrap up our event tonight, let me get back to our slideshow here real quick. Maybe if it'll work, give me just a second. There we go. So to wrap up tonight, we do have a post-event survey. This will be emailed out to all of the registrants tomorrow. Or if you would like to, you could take your phone out right now and scan the QR code that's on the screen and fill out the survey. Upon completion of the survey, we'll mail you a $15 guest card, or you can stop by Public Health to pick it up. Deadline to complete the survey is December 10th at 6 o'clock. And then also wanted to invite all of our attendees to join our Teen Action Council. This will help teens develop leadership skills to make a positive impact in your community through substance use prevention activities. And there is information at p4psauc.org or scanning the QR code to apply to join today. So with that, I'd like to thank everybody for attending tonight. Big thank you to all of our panelists. Really appreciate Ashley from Healthfirst. We appreciate all of the teens from Patch that answered the really tough questions and shared their experience to help educate parents and teens in our community on a difficult to discuss topic. So thank you, everybody. Hope you all have a wonderful evening.